fatalities. Last month, 48 from the London area died, with a total at 62 for the whole of Britain. It brings the deaths in London so far to 254. That's out of 355 nationally, and means that the figures are doubling every 6 to 8 months. Professor Avrion Mitchison, an expert in vaccines, says the situation is now so serious that experiments with animals should be abandoned and tests on people started immediately. Professor Mitchison, surely you're putting people at risk to use them as guinea pigs with untried vaccines.
Well, let me begin by making one point clear. Not for one moment would I or anyone else suggest that animal experiments should be discontinued. We need all the information we can acquire from animal experiments, but we do have to remember that so far no animal has ever contracted AIDS, so there's a limit to what we can learn from them.
But it is a very unusual step, isn't it, in your field to suggest using people as guinea pigs nevertheless?
Not at all. It's absolutely standard in the development of any vaccine. An essential step is a phase 1 clinical trial, which involves a handful of volunteers, a small number of normal individuals who are willing to volunteer in a procedure which is nearly always and can be arranged to be very safe.
Well, may I quote one of your colleagues to you, Dr. Brian Gazzard, who's a consultant AIDS expert from St. Stephen's in West London. He's treated some 200 AIDS sufferers. He said tonight he thought to use humans for trials was extreme. He also said, we're all waiting for the results first from the monkey trials. We must be sure that a vaccine is safe before it's used on a sufferer. When you're dealing with lives, you can't cut corners. Why do you want to cut corners?
Nobody is suggesting cutting corners. What we do have to make sure is that adequate effort and impetus goes into vaccine development. Vaccines that are being developed at this moment all over the world for a variety of different purposes, mainly for the great tropical diseases, all of them involve human trials sooner or later. In my view, we've reached a stage in AIDS vaccine development where human trials would be appropriate. I'd like to make this point to you. In 1910, the yellow fever vaccine, the newly developed yellow fever vaccine, was being very widely used to protect the men who were building the Panama Canal, and it worked for those purposes. In 1910, we knew far less about that virus than ever we knew about AIDS at this moment.
Do you think that London can lead the field in the search for an AIDS vaccine, rather?
No, I think we have a part to play, and that part should be in collaboration with and should build on the experience in America, and should also be in collaboration with our partners in the rest of Europe.
Professor Mitchison, thank you very much indeed.